Urinary incontinence. It's not a topic that a lot of people like to talk about, and it's really not a topic that's often talked about for men. But did you know that 1 in every 20 men will experience urinary incontinence in their life? And a most recent research study indicated that 38% of men experience urinary incontinence over the age of 60 years old. So if you're experiencing urinary incontinence, you're not alone. But there's hope. Urinary incontinence is an issue that can be resolved and oftentimes cured. So let's start talking about it. Men can experience varying levels of urinary incontinence, from light episodes of incontinence to very severe episodes of incontinence. Now let's get something straight. Any kind of urinary incontinence is distressing. Now, some men might think that dribbling a little after using the restroom is normal, or using toilet paper in their pants to dry up leaks is something that guys just do as you age. While these situations might be common, they're certainly not normal. This kind of incontinence is called light incontinence, but that certainly doesn't make it any less distressing. Urinary incontinence, especially as the severity of symptoms increases, has tremendous impacts on men's quality of life. Some of those include depression, avoiding activities that they once loved to do, stopping exercise, avoiding social interactions, and even limiting diet and fluid intake, all in the efforts of managing urinary incontinence. Now, wearing protective garments and pads might be a great short-term solution to boost confidence and get men to socialize. But what about when it's time to be intimate? Men often report shying away from intimacy for fear of urinary leakage during sexual activity. There are many factors that can cause dribbling or light urinary incontinence. For example, urge urinary incontinence and stress urinary incontinence are the most commonly associated factors. Urinary urge incontinence, coined by the International Continence Society, is involuntary loss of urine with or immediately following a urinary urge. Stress urinary incontinence is when there's involuntary loss of urine when the intra-abdominal pressure increases with activities like coughing, laughing, sneezing, or jumping. Overflow incontinence is often not talked about, but it's just as important to discuss with light bladder leakage. Now, overflow incontinence is leaking when the bladder gets too full. Now, this might be because someone is having difficulty emptying their bladder, or they're just holding urine in for too long, often greater than 4 hours. So, what can men do to help manage light bladder leakage? General exercise like walking and strength training exercises your pelvic floor muscles, but it also helps to maintain a healthy weight, and both help to lessen the risk of urinary incontinence. You'll also want to watch out for some common bladder irritants like alcohol, artificial sweeteners, caffeine, carbonated beverages, and citrus drinks. Another bladder irritant is concentrated urine, often a result of restricting fluid intake. So you might be thinking, well, less input will equal less output, but that actually can make urinary incontinence worse. So sip water gradually throughout the day to help lessen the irritation of concentrated urine in the bladder, but also decrease the potential risk for recurring urinary tract infections. Pace don't race when urinating. Please give yourself plenty of time to empty your bladder completely. And lastly, tailored pelvic-specific exercises and training has been shown to be quite effective in curing urinary incontinence. So please connect with a qualified pelvic health therapist in your area. And a big thanks to Aeroflow Urology for encouraging this conversation around urinary incontinence. There are too many people suffering in silence, and there's so much that we can do about it. Check out their free supplies at Aeroflow Urology, and also Medicaid Services offers free continence care supplies as well.